Hi, sir. Good evening. Hi, sir. Good evening.
Is it Soumya here?
Yes, sir.
Hi, Soumya. Good evening. How are you?
I'm good, sir. And what about you, sir?
I am fine. I am fine.
Yeah,
Just
just a minute,
waiting
sir. I'll
once
make you
again.
the co-host.
Let me just adjust
Yeah.
it. It's fine.
Sir, I have make you the co-host, sir. You can share the screen and start the class, sir.
One second. Yes. Just a second, Soumya. Let me
Yes,
arrange
sir.
and then you can start to record. Let it come first.
Yes, sir. Yes, sir.
Yes, I will move it to the side. I'm sorry. Yeah. Use the slideshow. Yes. This also have to move a little bit above. Take this annotate. Oops. Yeah. Soumya, I think we can
Yes,
start.
yes, sir.
Hello, good evening, students, doctors. Once again, welcome to our 90-day University Prof Pre-Final Mastery Microbiology. Myself, Dr. Santhosh. I'll be a microbiology educator. So we have completed a mycology and parasitology very well. And now we are going to a virology topic, virology number 1. Yeah. So before going to the discussion, a little bit more, we'll know about what's happening in Auricle very briefly. I'm going to explain you. So what we are going to do here is we are going to have a rapid revision of all important questions, volatile fact about quick revision, very quick revision, high yield topics only, repeated questions, very important question which you can't miss for your final exams. And also the most expected topics will be covered. Expected means sure shot, you'll have that questions very much, you'll have it. Okay, so it's not only for university prof exam, it's benefit for your NEET exams also, and for FMG students who's going to give their, when they come back to India to give their exams also. It's going to be very helpful for everyone, right? So what else? So we know that today the topics which we're going to be discussing is again long questions and rest are short questions. Short question, long questions. It's our first question is about the viruses. In viruses, you're going to talk about classification and the cultivation, which is very important. Always question asked. Okay, and also differences between virus and bacteria. Another one is your AIDS, HIV. HIV is a question where you cannot miss it. It comes in any form. It will come for you. You'll have a question on it. Okay, you can't miss it. If not this, then again it be in your medicine or it could be in your pediatrics. So HIV will be repeated everywhere. So it's better to know it. Yeah. So we will discuss it in a very easy and nice way. And short notes, we're going to talk a lot of virus inclusion bodies, important short notes. Again, interferons repeated. These are all like repeated many times. And you can always have this question in your examination paper about the bacteriophage and then cytopathic effect of viruses. And again, see HIV, opportunistic infection. Either short notes or short notes or long notes. HIV is mandatory. You will have HIV question. Okay. So what else? So next is here, why choose Oracle? You know that we are repeating it again and again. You have very good recorded classes, live classes, which is going on now. In the practical session, you'll have exam module and hard copy books. It's all very popular in Oracle. These are the things we're going to offer you. And then you can see this recorded classes. Recorded classes are very recommended, highly recommended, because it's flexible learning. Even if you miss something during any of your live class or whatever, everything is already recorded there. Expert instructions will be there. Convenient revision. Anytime, anywhere you can read the topics. Okay, fine. Next would be your live class. The live class is what we're doing now. You're going to have an in-depth coverage. Experienced educators will give you exactly what are the points to be presented during the exam, so that you don't have to read all your whole book and confuse yourself. Stick to the point and you will go through very good. You'll get a good score with that. Okay. And an interactive learning session, what we are having now, right? Next. Yeah. So next would be an express exam module. That's what, very important. We are going to complete the syllabus in 20 hours, in 16 hours. Answer writing skills, how to write, how to speed, where you have to put a diagram, where you have to write the introduction part and how to point by point. All those things will be revised. Okay. And expert educators. Once again, we will be teaching you all these things. Okay. Then what else? One-to-one doubt clearing session is very new and it's going to be amazing because many of the students feeling shy, they don't want to ask in front of other students or whatever what happens in our classes. That here we don't need to worry about it. You have a direct student centric approach. You students, you are going to ask us question and we are going to help you. You'll give special attention especially for you to make sure that you are going to not just pass, also score good marks. Okay. And a safe learning environment is there. That is another benefit of this one-to-one doubt clearing session, right? Next is a hard copy notes. Again, going to be very, very useful. Not if you're tired of always seeing through your laptops or your iPads, you can just open the book and that is going to help a lot. And you can write there all important points and etc. So that is also very, very useful for you. Question bank. We have very good, amazing question bank. Seen all 10-year questions from different universities, medical colleges, and they've compiled it very, very well. So you will be benefited very, very. It's going to be very, very useful. Okay. So nothing will come in most 95% questions will be from the question bank only. You can't miss that. Yeah. Next. So the subscription plans, that we have a foundation basic one, and then advanced learning plan, complete learning, and ultimate MBBS course. So everything has its own benefits. Everything is useful. You choose the best one. And then, of course, you're going to give a good offer. You can use this code Dr.Santhosh 20 to get very good discounts. And it's really worth it. It's going to be very, very easy. So your MBBS curriculum is going to be very easy. You will not feel that tiredness. It's going to be amazing. You'll enjoy it. Okay, what else? So now we're going to a topic. Now let's start our topic, which we're waiting for. Okay, so the first question is basically classify the viruses, and then write the method of cultivation of the viruses and the difference between viruses and the bacteria. Okay, first of all, the virus classification, very nice topic. This is definitely, you must know, you can't miss it. Okay, so let's write about the viruses. When you talk about the viruses, see, when you talk about the bacteria, we classified it as into gram positive and gram negative, right? Gram negative. And I always told you to remember gram positive people, they go to where they go and have their food. They go to McDonald's. McDonald's is the shortcut, right? McDonald's is a shortcut. Mycobacterium, all the things, actinomyces, anthrax, corynebacterium, clostridium, diphtheria, diphtheroids, and staphylococcus, listeria. Okay. And rest all are gram negative. That is a bacteria part. We are going to cover it. It's going to come in upcoming topic. When you talk about viruses, you're going to classify it into two things. What are they? One is a DNA virus, and the other one is your RNA virus. DNA virus and the RNA virus. Let me just erase this. We don't need bacteria now. Okay, that's it. Yes. So we are going to have RNA virus, DNA viruses, and the RNA virus is the basic classification. RNA viruses. So remember that DNA viruses are one happy viruses. Okay, they are the happy viruses. Okay, remember it as a happy virus. So make it as H double H A P P P. Okay, Y is silent. Okay, you can sometimes, people, you can say be happy also, you can say, because bacteriophage also comes, but because bacteriophage is not causing any clinical disease, so we're not adding it, but still nothing wrong in adding a bacteriophage. Bacteriophage is also a DNA virus, no problem. Okay, but important is happy. DNA virus is a happy virus. This you're going to remember. Okay, yes. Now, what H stands for? H stands for, the most important virus group, herpes group. And other one is your hepatitis, but not all hepatitis B virus, HBV virus. Okay, A for adenovirus. This is, you have a lot of confusion, so you have to be thorough in a DNA virus. You will not confuse, no need to worry. P for first pox virus. Let's make pox virus, and then comes your papilloma virus, and then another P is there, parvovirus. So these are the classification of DNA. First list you're going to write. Okay, right? Now, when you're going to write about the RNA viruses, we have different classification also. So we will talk about that also. So in RNA, before classification, a little bit more about DNA viruses. You should know DNA viruses are, all the DNA viruses are double standard. DNA viruses are always double standard. Okay, they are double standard. And your RNA viruses are Usually single standard. You're going to write this one. At this point also you should write, okay? Double standard, single standard. But what are the exception? We have exception. Usually they are double standard DNA viruses and single standard RNA viruses usually. But exception, both the cases you have an exception. So for DNA virus, the only exception is if you remember, or if this is your first time going to learn, please remember only one virus which is single standard DNA viruses. Single standard DNA virus. So which is that single standard DNA virus? It's your parvovirus. Single standard parvovirus. So how to remember? In parvovirus question we will talk. Remember Paru. Paru from your Devdas movie, remember Paru, Paru, no, we call her the Paru is the smallest girl and she's single. She's single and small. If you see Aishwarya in that movie, she's very single and small. That's what we always remember. Like the whole, most of the microbiology people remember Paru only. So remember the Devdas movie Paru, Aishwarya Rai. She's single and she is small. She's the smallest virus of all the virus. Okay. So Parvo, you got it? Okay. Next. Single cell RNA virus exception. Yes, we hear exception. That means there are some, most of them are single standard, but we have a double standard RNA viruses also. For double standard RNA viruses, all you have to remember is RRR movie. Okay, RRR movie. Very simple. It's a double standard. Okay, so R for your Rio virus. Rio, Rota, Colorado. Here also you have an R. So it is R. Okay. Very simple. Okay. Very, very simple. So this is another, when you write about DNA viruses, you're going to write this part. Okay. Now after this class, we took the viruses classification is very, very, very huge one. I'm going to write it here also. This is basically virus classification. We are in virus classification. It's not over yet. Okay. You don't think just you write DNA RNA, it's over. No, it's not. First, you're going to write about DNA RNA virus. Then you're going to say about all our double standard RNA exceptions you're going to write. Okay. And after this, what you're going to do? Next point. Okay. I'm moving to the next one. So now you have to write again. We have a naked DNA, naked RNA viruses also we have. Okay. That's also very, very important. We have naked DNA virus. See, most of them are, we have the viruses have envelope, right? Envelope. So there are naked DNA and naked RNA. The meaning of naked RNA DNA viruses is they have no envelope. There is no envelope. Usually they have, but there are some viruses which are no envelope or non-enveloped. Okay, no envelope. So we call it as naked DNA. For naked DNA, the shortcut is you have to remember, you know, which when a female, when you want to do a pap smear, you tell the female to get naked, right? So pap smear, pap, remember as pap. Pap. Okay. So in this, how to remember DNA, which are the pap. So shortcut is one is PARVO, parvovirus, we just spoke. Another one is papilloma, because there's no pox virus. P also will come in DNA, so you don't need to confuse. So papa, okay, you remember as a papa. Remember as a papa. And A for your adenovirus. Adenovirus. Okay. So this is a naked DNA. What about naked RNA? Naked RNA shortcut is crappy people go naked. You know, some of the crappy people, they go naked. Crappy people go naked. So C for calci. So remember Kali the fighter, he's naked guy. He's a naked. Kali is a naked guy. R for Rio. Rio means you always remember that movie Rio Bird. Rio Bird is naked. Remember, it's birds doesn't have no. So Rio Bird. Okay, Rio virus. And A for Arene. A is for Astro. Astro is basically stars. Stars in the sky. They don't have cloth. No, they're just there. Rio. I'm telling you to remember the Rio Bird. Okay, you're going to remember the beautiful Rio Bird. And P for who is Picorno. Picorno. Nowadays, people, if you want to take the picture, they go naked. So remember like that, naked. Okay, very important. Another one is Kali. Kali is a fighter, no? The fighter guy, our boxer, no? Kalsi. So these are the naked RNA viruses. Very, very simple. Another classification. Okay, done. Now we are going to the last classification. The last classification I'm going to talk now. That is basically classification for RNA viruses. So now RNA viruses, because we didn't give any name for RNA viruses, we're going to talk about, see, RNA viruses, they have a huge group. You have a, you know, the groups goes like this: orthomyxovirus. We have orthomyxo group virus, and then we have para orthomyxo group virus, and then we have another classification, flavivirus, and then we have another group, toga viridae. Okay, this classification is huge, so you don't need to expect, they don't need to expect you to write all the things. Some of the things you give exam, that's enough. So that's what you usually RNA viruses, most of them are most of them are positive stranded, but we have a negative strand. We have negative strand. Now, negative sense. You can say negative sense is better. Okay, negative sense. Usually it is positive sense, but we have negative RNA viruses classification. You can have, yes, negative sense RNA virus. We have negative sense RNA virus 1, and other one important segmented RNA virus. Segmented RNA virus. Okay, segmented RNA virus. This is an important classification. That's what is a huge big question, because everything should then one more question also very important. Going to MCQ is very important. So negative sense RNA virus. Remember this guy. This guy is a very negative. Who is negative? The guy name is called filthy. We call him as a filthy Prabo. Prabo. Filthy Prabo. Okay, filthy Prabo is a negative guy. Okay, so filthy for filoviridae. Philo is a type of RNA virus. So it's everything is coming. Filoviridae group, filovirus or filoviridae group. Okay, P for param. Paramoxy virus. Param. Remember, param is a negative guy. Okay, negative sense. Okay, phil is a negative guy. Param is a negative guy. Or for rabies virus, rabiviridae. You know, the rabies dog is negative, no? So it is negative. Rabies dogs are negative. So rabiviridae. And these three are very easy. A for arena, B for bunya. Bunny is like we usually call our Allu Arjun, no? Allu Arjun actor, we call him Bunny. So Bunny, his girlfriend is Arena. One more, remember Ortho guys. Myxovirus. These are the negative people. Okay, remember like that. For exam purpose only, remember, right? Phil is negative, Param negative, Rabbit's dog is negative, Arena, Bunny's girlfriend Bunny and his girlfriend Reena are negative, and all the ortho doctors are negative. They are not negative, but just for exam purpose, remember. Okay. Now, when you take up segmented, whenever you heard so segmented, gym guys who have a six-pack or whatever segmented, the names are usually like Bora, like this. Okay. If you remember, all the big builders, bodybuilders, came from Haryana or Punjab, anywhere, South, Tamil Nadu, wherever, they have this name called Bora type of things, bodybuilders. Okay. So how to remember B? Again, once again, B for Bunya. Bunya is again, remember Allu Arjun. Allu Arjun, of course, has six-pack. So it's segmented. Okay, Bunya. O for all the ortho guys. If you remember ortho doctors, it's actually orthomyxovirus, the flu virus. So when you take, or if you forget to remember, all ortho guys, the doctors who want to do ortho, they won't have six-pack. That's what they do, the ortho. They choose it because to get a good six-pack and impress girls, right? So remember like that, ortho. And R for, again, here, it will be your Rio virus. Rio virus, if you remember that movie, Rio bird, in that Rio movie, they have a segmented six-pack, like that you remember, segment six-pack. And here for Arena, wherever Bunya goes, Arena also goes. Arena, you remember Reena. So this much, this is the classification. A little bit, it looks bigger, but it's worth it because you'll have one or two objective questions lifelong you'll have. Not only for a university exam, also for FMG, also for your NEET PG, INACT also you'll have. So that's what I'm stressing on, all full classification of viruses. This much if you know, more than enough. Okay. Yes. Now next one. Where you're going now? We are going to, now they told methods of cultivation. Methods of cultivation is very important here. Why? Method of cultivation. So for virus, does you know that viruses will not grow in normal artificial culture. Not grow in artificial culture media. Only bacteria will grow in artificial culture media. Okay, it will not grow artificial culture media. So we need to have a special media to grow. So what are the special media? So viruses grows. One is your animal inoculation, number one. Okay, and number two is your egg inoculation, and third one is your cell culture, cell or tissue culture. Okay, these are the three ways to grow. So animal inoculation, when we talk about animal inoculation, first one, very simple. Commonly, we are not using much nowadays. One thing which is a suckling mice, the small baby mice, suckling mice we use. Suckling mice, but to grow only two viruses. You remember suckling mice, they live in AC. They like to live in the small babies, they like to live in AC. So A for which are the viruses? Arbo virus number one, and other one is your Coxsackie virus. Coxsackie virus. You have a one mark question also, and in exam also, if you write, mainly animal inoculation is for vaccine. To make a vaccine or to study the pathogenesis of the viruses. Okay, mainly for vaccine. Okay, pathogenesis to study. That's it. This much only for your animal inoculation. More than enough. Examiners would be happy if you write this point. Egg inoculation. Now, in egg inoculation, this is a picture. I don't want to make you stressful here. We have a picture that you can see. So when you talk about egg, I'm going to just briefly when I'm writing. I'm not going to make it. This is an egg, let's say, and then this thing. So now let's start. First of all, you will have an embryo, right? You will have a baby. That is the baby the chicken, no? Baby chicken. So embryo. So embryo surrounded by a cavity. Okay, like this cavity. That is amniotic cavity. We have amniotic cavity. Number one, amniotic cavity. Cell culture will be next. Amniotic cavity, number one. And then this outer line, under the egg, you have this layer that is called chorioallantoic membrane. We call it as choreo. Sometimes amniotic also, but chorioallantoic membrane you call chorioallantoic membrane. Okay. And then exactly here you will have so this is the chorionic membrane, and then there's another cavity just outside. It will come, that is your allantoic cavity. Okay, I'm going to write it here. Okay, allantoic cavity, allantoic cavity. Okay, allantoic cavity, amniotic cavity, cam, and one is opposite to this. You will see here yolk sac, the one layer like this, that is your yolk sac. Okay, you can draw a rough picture like this and made it. Okay, this is the fetus, and this is yolk sac. Always you remember, na? Opposite to the embryo only will be the yolk sac, and surrounding this is the amniotic cavity, then followed allantoic cavity, and outermost is the chorionic membrane. Okay, so let's go from center, then let's make like this. Yolk sac will give number one, and then comes your amniotic number two, then comes your allantoic layer, and then comes the chorioamniotic layer. Okay, fine. You're going to mark this one, and after that, what is the use of each layer? Very, very simple. Very simple how to write it. I'm just going to explain you now. See, first let's talk about the yolk sac. Yolk sac, you remember yolk, the shortcut is car. A car full of yolk sac. Remember, a car full of yolk sac. Okay, sometimes you can remember duck, yolk duck. Okay, remember like a yolk duck. Duck's yolk is in the car. So what are the organisms? You can grow chlamydia. This is a bacteria exceptional, or for rickettsia. You remember they have the properties of virus. So chlamydia, rickettsia. A for your, again, arbovirus. Arbovirus. And why it is a duck? Because the Haemophilus ducrei, also bacteria, but we can grow it here. Okay, we can grow it. So in INCT exams, they can ask. That's what I gave you. Yolk, duck of the yolk is carried in a car. That's it. Okay, first layer. Second is amniotic cavity. Amniotic cavity is basically to grow the influenza virus growth. Okay, to grow for the cultivation growth. Okay, cultivation. But what about allantoic? Allantoic cavity also influenza. It's going to help us too. But only thing is this: Allan is a guy who's going to make us what? Influenza vaccine. Remember, okay, amniotic is for the culture. Amniotic is for culture, but Allan is going to make a vaccine for us, influenza vaccine. So allantoic for influenza vaccine. What about cam? For cam, these days which camera is very popular? Any idea? Vivo. Vivo is very camera. They call it as a hot Vivo camera. Nowadays, they're calling it as the Vivo camera as a hot Vivo camera. Can you believe that? Nowadays, it's called hot Vivo camera. Why did they say hot? HSV virus. Why this VV came? Variola, to grow the variola, and also vaccinia. Variola vaccine, the same family. Okay, if you forgot also, all VVVs are there. Variola vaccine, this much only for egg inoculation. Okay, you're done. Okay, now next we are going to the cell or tissue culture. Okay, now cell or tissue culture, I'm going to erase it, and I'm going to now go to write your cell culture. So when you talk about the cell or tissue culture, it can be many types. See, first one is an organ. First of all, organ culture. And then there can be an implant or tissue. I would simply say tissue culture. Tissue, first organ, then come tissue. And then the third one would be the cell, right? Like the cell culture. So organ culture example is you use the tracheal ring to grow which our favorite virus, that's your coronavirus. Coronavirus. If you remember, tracheal is a ring and corona O is also like a ring. Okay, O. Remember like corona. Okay, O, corona. What about tissue? Tissue, especially lymphoid tissues. Lymphoid tissues we can use for growing the lymphoid tissue here. We can go for adenoviruses can grow there. Many viruses, but one example is this enough. Cell line. Now, cell line is important. Cell line is you have basically cell line. We have primary cell line, secondary cell line, and then the last one is your cancerous cell line. That is basically cancerous cell line. So we can use different type of cell line for different things, right? So basically cancerous cell line is most commonly used. So primary cell line is basically anything related to three things. One is your monkey, other one is your human, the living things. Okay, monkey, human, and the bird you remember is a chicken. Okay, chicken you remember. Okay, now what about this? So now here monkey kidney cell. Monkey's kidney cell is a primary cell line. kidney cell can be used. Human will be amniotic, human amniotic cell, and chicken would be your chicken embryo, always chicken embryo cells, chicken embryo cells. This much only. Okay, very, very simple. Okay, amniotic and embryo, all animals will come primary. Secondary, only one thing you have to remember, fibroblast. Okay, fibroblast. The fibroblast is always secondary. That's it. So cancerous cell line is interesting. See, in primary cell line, the cell division is normally usually 5 to 10 cell divisions only. In secondary, it will be some 15 to 10 to 50, you can say 10 to 50 cell division. Here, cancer cells are very fast. So expressive, excessive cell division. You have excessive cell division. So here you can give all the examples. Your McCoy cells, HeLa, HEPA, KB. These are the cells. Okay, so everything come from example. HeLa is from cervix cancer. It's derived from the cervix cancer. We can use for growing the cancer. It goes fast. Okay, and this also McCoy also from the cervical cancer, cervix cancer. Okay, and HEPA, HEPA is from again epithelioma. It is again laryngeal cancer. It's a laryngeal cancer. KB is also laryngeal cancer. So these are the cells. Okay, this you give the example for growing. That's this much only. Very, very simple and easy. If you write this one, the examiners will be happy. This can be a short note also. We have, okay, can come as a short note also, but remember these things for now. Okay, right? Okay, now next. A virus, and very, very easy question. You must be knowing from your +2 only, viruses and bacteria differences. Very, very simple. I'm going to write it very fast with a limited time. Even you can tell only. It's already viruses always intracellular. Here it can be bacteria, can be intra or extracellular. Yeah, it can live inside the host cell or it can live outside the host cell. Number one, viruses always have a DNA or RNA, never both. But bacteria has both DNA plus RNA nucleic material together. Okay, fine. Next one, there is no cell wall, no cell membrane, no true nucleus, and then that bacteria also. So, and then there's one more thing, is there is no ribosome, nothing is there. So here you have everything is positive. Okay, right. Now, next, what is important? It is easily filterable through filters. Easily it is filterable. Here, no, it is not filterable. The size is bigger, except mycoplasma, so it's not filterable. So, next one. What else you can say? So, yes, other one is, other important thing is that you can, no, here, that's what, because virus, antibiotics cannot as. Antibiotics will not work. And here, of course, antibiotics will work. Okay, so you can't microscope, only electron microscope you can use only electron microscope to see. Here you can use any microscope can be used to, you can see. This one you can't culture, no artificial culture media, but here yes, we can. All the bacteria can be cultured bacteria. Finish. This much only. Very, very simple and easy. You'll get full score for this. Okay. Right. So this is a big question. If you're writing all these points I told, you'll get very good. Out of 10, definitely 8, 9 marks that you should get. Okay. Right. Now we're going to next question. What's the next question here now? So every explanation given here, I never missed anything. So you can see all the classification you can see, and then you can see all the viral cultivation methods. The picture, this picture is better than my picture. You can go through this also. Okay, and then all these things, and the cytopathic effect, we're going to, it's a separate short notes, we're going to get that virus classification is given. Okay, now one MCQ, which of the following is a single standard DNA virus? So DNA means happy virus. So in happy, one person is single. Who is single? Our Paru is single. So you guess the answer? I'll give 5 seconds. Paru, so parvovirus. Right. Answer is right. Okay. Yes. Now next one. Yeah. Enumerate the sexually transmitted infection, number 1, and then describe the morphology, pathogenesis, and laboratory diagnosis of human immunodeficiency virus. Note on prophylaxis, I'm not going to talk. This is a more pharmacology thing. Okay. I don't know why they've added it, but yeah, in pharmacology, the detail you can tell. Now I'm not going to mix that. It will be too much for you. Okay. Now we stick to the topic, stick to microbiology. Okay. Now, first one, look at this. So what are the sexually transmitted diseases? Sexually transmitted disease, you can classify ulcer or ulcer-based or discharge, urethral discharge like that, or better you write like this according to the organism. That will be more easier, and examiner also will be happy. And you will also not forget anything. Okay. Parasite. Fungus, again, I'm not going to, because candidate is plus minus. So these are the main things you're going to write here. Now, bacteria. So when we talk about the bacteria, which are the bacteria, the most common one is, if it's discharge, gonococcus. Gonococcus number one, chlamydia. Gonococcus and chlamydia, they are for discharge purpose. And when we talk about ulcer, you have Treponema pallidum. Treponema pallidum, which causes the syphilis. We're going to discuss in bacteriology more. Okay, syphilis. Other one is your Haemophilus ducrei, which causes chancroid. And also we have one more thing is Klebsiella granulomatis, okay, which is causing granuloma inguinale. Okay, don't worry, we are going to talk on other topics also, but now if you know, it's better. Okay, yeah. And viruses, the most common is a herpes simplex virus. Apart from that, you can HIV virus, you can add hepatitis B virus also, you can add HCV virus, very less. So we can add these three viruses. Okay, herpes simplex type 2, HIV virus, and HPV virus. So HIV is the one here. And parasite, the most important thing is your Trichomonas vaginalis. We just spoke Trichomonas. We just spoke in a parasitic. These are the STD infections. Okay, this much. You write this list, enough, more than enough. Now, morphology, pathogenesis of HIV. We're going to talk about HIV viruses. Okay, now I talk about the morphology. You're going to write like this. First of all, morphology of HIV. Morphology of HIV. Whenever they ask a morphology of HIV, you better draw the picture. More than explanation, better draw the picture. That's the best thing. The examiners will be very, very happy. No. So now let's start. So let's go from the outermost. The outermost layer will be like this. Outermost, the envelope, it's like envelope layer. So this is the one here. So in the outer envelope layer, you draw like this. And of course, you're going to write all the, first of all, excuse me. Yes. So you're going to write this the spike-like things. Okay. You're going to write everything outside like this. Many you should write. Okay. I'm just trying to, you use a special compass or anything to write, because influenza virus picture or HIV virus picture, always they'll ask in the exam. So be careful with that. Okay. So this is the outer envelope protein. That is basically, this is envelope, which is a protein and this thing. So protein is, that is your group 120, and other one is your inside is your group 41. Okay, group 120 group. They are the envelope proteins. And then these are some lipid layers. In between, you have the lipid layers will be there. Okay, this is the first layer. Now, next layer. Then next comes your, so next would be, we are going to draw a core. Okay, this is a core protein. Okay, this is a core protein, which is basically different. There are different things. Usually we talk about group GP24 and then GP17, group 17 proteins we talk here. Okay, these are the things. Okay. Then what about inside? Inside, the most important thing is that what you're going to write inside is, if you remember, it has how many HIV has? Two. This is the most important thing. The examiners will be so happy if you put with color pen if you write. So you have two single stranded RNA. That is very, very important. Okay. With that, you're going to write all the beautiful enzymes. What are the enzymes you have here? The most characteristic enzyme is your reverse transcriptase. Reverse transcriptase. And you will have the integrase. And then, of course, protease. This much only. Morphology, right? Okay, and then you can write all the explanation. Of course, the three genes, these all are for these things, the coding, for these things, it is the envelope. You have envelope gene. And for this, it is the gag gene. Okay. And for this, all the enzymes, it is the pole gene. Okay, that's it. This much you write. Reverse. These are the characteristic feature for HIV is reverse transcriptase, and it is two double single stranded RNA. This much only. Okay, for morphology. Explanation you can write. I'm not going to tell, because if you draw the picture, it's more than enough. If you want a little bit, you can explain. No problem. Okay. Yes. Now a little bit about the pathogenesis. Now, when you talk about the pathogenesis, you should know that pathogenesis. Yeah, in pathogenesis, what is the favorite? Which is the favorite cell? Which is the favorite cell of your HIV? HIV usually infects which cell? Your CD4 T helper cells. cells. Which one? Especially it uses the group 120. Group 120 protein, they bind to CD4 helper cells. This is first one. Okay. Now the CD4 T helper cell, it attaches the C. Okay. Now there are two receptors which is going to co-receptors which is going to help in attachment. What are they? One is your CXCR4. Okay. Another one is your CCR5. CCR4, it helps in attachment with the T helper only, co-receptors, T helper. Whereas CCR5 is going to help with attachment with the macrophages. Macrophages. Okay. So now what happened? When these bindings happen automatically, what happened? Your CD4 T helper is going to decrease. So that's what happened. Or immune system, the cellular immune system, cellular cell immunity decreases. Okay, and that's what you have. What all the secondary infections will happen. Okay, and moreover, due to the mutation, if you remember, one of the highest mutation is happening. It can happen anywhere. One is because in the reverse transcriptase enzyme itself will go mutation, or any of the group 120, which is very common, followed by other things. So because of this reason only, we are having the infection. This point you're going to write it. Okay. Now let's go to the lab diagnosis. Next point is a lab diagnosis. Lab diagnosis is very, very important. Here, you have to know very clearly. You can explain more, but at least the first thing is when you write a lab diagnosis and then you're going to list it. How are you going to list it? First of all, non-specific test. Non-specific HIV tests. Okay, general test. So in that, the first point which you're going to mention here is your CD4 count. CD4 count. Okay, CD4 count. This you're going to enter. So what happened when the CD4 count can go less than 500, or CD4 count goes less than 200, CD4 count can go less than 50. We've discussed many times when the CD4 counts less than 50, the risk of which diseases are very, very common. You know, one is your tuberculosis. You can get candidiasis. You can get herpes. Any herpes infection, simplex or chickenpox, whatever. Okay, herpes zoster, basically herpes zoster, Kaposi sarcoma, and then other one is you're going to be HPV. These are the common infection less than 50. And less than 200, I've repeated many times, it's your toxoplasma infection, or you get the cryptococcus infection, or pneumocystis. These are the characteristic infection when the CD4 less than 200. Okay. And then CD50, you get CMV virus and Mycobacterium avium complex, MAC complex. Okay. MAC complex, three letter word, CMV, MAC complex will come. These are the common, the non-specific tests. Okay. Done. Now, next one, the main test. The main test, in the main HIV test, for the main HIV test, we classify them into different. First of all, we classify them in like this. How we classify? We classify them into, first of all, screening test. We have a first test called screening test. Then we have a supplement test, supplement test. Then we have confirmatory test. These three things you must write first. Then you can explain everything, ELISA, whatever. Screening test, what are the important tests you're going to do? Screening test is, of course, ELISA is one. You will not forget. If it then there is something called, we have Combs test. Not that Combs test, it's a comb test. Combs is basically this, it has multiple comb like this. So many samples can be detected, positive or negative. Screening test, so Combs test. Or you have tried out because we have HIV 1 and 2. So to distinguish 1 or 2, we have tried out test. Also, we have what? The rapid test, that is your CAR test or latex aggregation. You see immunochromatographic test. Immunochromatographic test. Chromatography test. ICT we call. Okay, these are screening. Supplement test, usually Western blot. Western blot is commonly used, but again, it is delayed. But it is also sort of confirmatory, but takes a lot of time to confirm. So it's not recommended nowadays. Not confirmed as confirmatory. Okay, Western blot, other fluorescent, immunofluorescent assay, all these things are supplement test. Now, confirmatory is important. Confirmatory, you know, that is what your that is your PCR. Okay, PCR, RNA PCR. Okay, you're going to do for RNA PCR, and this is the earliest test to become positive. That's what it is, confirmatory. Earlier test means 12 days after infection, 12 days after HIV infection, you get it positive. Okay, and other one is your P24 antigen test. P24 antigen test. This is also earliest, But the only thing is it have 16th day. In 16th day, it will become positive. These are the points you're going to write. Okay. And for we can do PCR DNA also, but that is for pediatric group, for pediatric HIV. For pediatric HIV, you can do. Okay. And always remember confirmatory plus for prognosis. For prognosis means treatment prognosis. If you want to do, you're going to do again PCR RNA only. So this is the best test now. If you want to know the test early and confirmatory, you do PCR test. Okay, this much only for the confirmatory. Okay, so this I'm not going to talk about the other things and all. The prophylaxis I told it's not our topic, so I'm skipping it. Okay, now next questions are. So everything explanation, everything is given here. You don't need to worry. All the disease, everything is the disease picture. HIV 1 and 2 are there. There are a few differences. You can see that route of transmission. They haven't asked, but if you want, you can see this also. You know that also very well. The test, everything is mentioned here. CD4 count, etc. So which test gives HIV positive result earliest? Earliest. So which one you're thinking? 5 seconds. Just now I told the confirmatory test or test which become early positive is your PCR. Okay, RNA PCR. So that's right answer. Okay, next question. Next question. Yes. The viral inclusion bodies. I have to go there. Yes, viral inclusion body. Viral inclusion is important. Okay, viral inclusion body. First of all, what is viral? When you talk about viral inclusion body, they are the viral aggregates. They are basically viral aggregates. They help in diagnosis. They help in diagnosis. They help in diagnosis of virus. They help in diagnosis of viruses. Okay. They help in diagnosis of the viruses. This is the main thing. Viral aggregate. On staining, it helps us in diagnosis. Okay. Now classification. How are you going to classify? We are going to classify them into, we have intranuclear inclusion. But I'm going to write IB. Okay. Inclusion bodies. And then we have intracytoplasmic inclusion bodies, and then we have both intranuclear and it is together they you will have. Okay, so this is the classification. So in intranuclear, we are again intranuclear is classified into two things. What are they? They are Cowdery A, and then it is classified into Cowdery A and COD or Cowdery A, Cowdery B bodies. Okay, Cowdery A type, Cowdery B type bodies. Okay, Cowdery A type bodies and Cowdery B type bodies. Okay, shortcut. How to remember this? Very easy. So just you will now. Cowdery A shortcut is you remember as Hey BAP. Hey BAP. Okay, Hey BAP. So A is Cowdery A and this is. So what are the diseases? H for herpes. Herpes inclusion body, which is called Lipschitz body. You just write only the name, that's enough. Lipschitz body. And why is the yellow fever? Yellow fever, it's called as a Tourist body. Okay, you remember, write the example, that's more than enough. Okay, BAP is B. A for your adenovirus and P for poliovirus. This much, if you give example, it's enough. Okay, right. Now intracytoplasm, so many things. Example, first one for rabies. For rabies, which one you remember? For rabies, it is your Negri bodies. For rabies, it's the Negri bodies. And then for pox virus, pox, you have many. Molluscum contagiosum, for example, molluscum contagiosum body. And of course, if you remember, vaccinia, for vaccinia, you have this Gauernary bodies. And we have Bollinger bodies for fowl pox. So these are the few bodies you have to write. Okay, in the cytoplasmic. When you talk about both, remember M and M. What are the MM? One M is the measles. And other one is your cytomegalovirus. In cytomegalovirus, it is called as owl eye bodies. Owl eye inclusion body. If you write only the name, that is more than enough. And you classify it, you will get full score. This much only for your diagnostic inclusion body. Short-term viral inclusion body, and their importance. Importance is for diagnosing the diseases. So these are the diseases it's going to help for you. Okay, that's it. Okay, now next. Everything is explained here once again. You don't need to worry. Everything is given in the picture. You can just see through it. Okay, yes. Now, next. So which of the following is not manifested as intranuclear inclusion body? So which is not intranuclear. That means you have to rule which is not HABAP, which will not come in the HABAP, which will not come. So herpes, yes, it's coming. Yellow fever, it's coming. Polio, it's coming. But P-pox, no, because pox is molluscum contagiosum body. So totally it's out. Okay, so pox virus. Right. Next question is your Viral interferon is very, very easy and simple topic. No mistakes in this question. Nobody is allowed to make mistake here, because first of all, interferons, what they do, they don't have direct action on the viruses. They usually cause inhibition of the protein synthesis in a host protein synthesis. Some of the protein synthesis are inhibited. So what happened? It has an antiviral property, antiviral action. It has antiviral action. Okay, antiviral. Also anti-tumor action, but generally it works like this only. It's a mode of action. No direct effect. No direct effect on virus. It will act through protein, inhibiting of protein synthesis. That means some of the immune response will go down. So that will help in protecting us from the viral action. So what are the interferons we have? We have interferon alpha, interferon beta, interferon gamma. Very simple. Okay, you're going to write the classification first, and after that you're going to write about the sources. So interferon alpha always comes from the which cell? Alpha comes from the macrophages. Okay, macrophage. Beta, the name itself gives you fibroblast. B beta, fibroblast. BBB. So beta B become easy. Okay, alpha is macro. Alpha man is a macro man. Remember, alpha man, macro man. But what about gamma? Gamma is from the T cells. Sometimes the natural killer also T cells. And one more thing, interferons, all they come in the innate immunity. Okay, and this is another point you add, innate immunity. It's a part of innate immunity. Okay, so this is the source. First of all, you're going to write the source. Now, what are the use? So these interferons, where are it's used? Definitely used in many places. So because of its antiviral property, interferon alpha, you can use it for genital warts. As a topical solution, you can use as a genital warts application, or you can use in many your hepatitis B virus, hepatitis C virus in form of this is also in a form of pegylated interferon alpha. To prolong the action, it is called pegylated interferon alpha also. Okay, so those are things used in hepatitis B, hepatitis C, hepatitis D viruses we can use. Okay, as a cancer, this is for the virus property, used for virus. For cancer, usually two cancers. One is your hairy cell leukemia, and other one is your Kaposi sarcoma, the most common cancer in the HIV patient. Okay, that's it. This is this function. Now, what about your fibroblast? Fibroblast usually used only in one disease, multiple sclerosis. Multiple because of its anti-proliferative effect. Both are anti-proliferative effect, anti-sclerosis. So these both has antiviral property. Remember, they both have antiviral property, but not this one. This one, interferon gamma, doesn't have no antiviral property. It doesn't have antiviral property, but it is used in one infection because this is gamma G, gamma. So which it is used? It is used in a chronic granulomatous disease. Chronic granulomatous disease. Very, very simple. Easy peasy. So 1 mark may definitely will have a short notes, or 1 mark may please write it. It is mandatory. Definitely interferon is examiner's favorite question. Immunology also it will come, but now if you know, it's very good. Okay, so this is because you're talking virus. So to kill the virus, we need interferon. So interferon is this thing. So mainly interferon alpha is most useful. Then these two have two uses: multiple sclerosis and a chronic granulomatous disease. Bas, this much. Okay, very good. Now we're done. It's very easy. I'm sure you're going to score that question. You won't make any mistakes. So next one. So everything is written here. You can go through this topic. Okay. Yeah, all the things mentioned very clearly. So interferon used for chronic granulomatous. So G is a clue. So now you tell me alpha, beta, gamma. So G for granuloma, G for gamma. So interferon gamma is the one we're going to use. Okay, I'm just getting it here. Now we have just two more questions. Very easy. Now they told the structure and the life cycle of bacteriophage. Bacteriophage, you know, everyone knows. You must have read long time only. So when there's a structure, this is the structure. What shape it is? It is a hexagonal, or we call bacteriophage as what? Tadpole. We call it a tadpole appearance, right? Tadpole. So I'll first draw the picture and then we'll come to the things. Okay. This is the common picture. Okay, I wrote it very simple. So you know that this thing will have they will have a capsid. Of course, it's a capsid. And then, you know, they are DNA virus. This is a DNA virus. And then, of course, you have what? Genetic material. You have a genetic material. That is a DNA. It's usually DNA, genetic material. Okay, capsid. And then we have a DNA. That's it. And this is a tail part. This is a tail. And this is a tail fiber. Okay, tail fiber. fiber. This is the structure. You're going to write this in hexagonal tadpole shape, which has a capsid and heading. Now, life cycle. When they ask you to write about the life cycle, you have two phases, lytic and lysogenic. Lytic and lysogenic cycle. Okay. The picture is already there, so I'll go to the picture and explain you from the picture. It'll be more useful for you. Okay. Yeah. Once again. Yeah, before going to that okay, the users will come back. So look at this lytic cycle. Lytic and lysogenic cycle. Lytic cycle means the host cell is getting killed. That is, lytic means host cell is getting killed. That is only lytic. So what happened here? You see this, our bacteriophage, it attaches to the bacteria. Bacteriophage means it is attached, it is causing something to the bacteria. So ours, this virus, bacteriophage is a virus attacking the bacteria. That's what it is called, bacteriophage. Then what happened? It goes and takes some penetration, then getting inside, and after getting inside, it takes some of the host DNA, and then what happened? It forms a it goes under assembly and then form a new daughter host cell. So those are all the small, it will break. The bacterial DNA material gets broken, and then whatever genetic material of this virus is going, they mix together and they form a daughter progeny, and then they break the bacteria and everything comes out. That is what lytic cycle. In lysogenic, they are smart. Genic, no? So what they do, they go inside. After going inside, see what happened? They go and fuse with the bacterial DNA. This both genetic material getting fused. And then what happened? That fused and divide. Here cell is not getting killed. Instead, the cell, the bacterial cell itself, it breaks, and then it is carried. The virus property is carried by the bacteria. That is lysogenic cycle. Very, very simple. Okay. So two cycle, lytic and lysogenic cycle. Okay, we have explained it. Right. Now, so because we told it here. So now we told, and of course, phage, I don't need to tell, the users are usually using phage therapy. That is the phage typing we use, mainly for Staphylococcus aureus we use. And phage therapy is for many of nowadays to treat the wound infection, to kill the bacteria, we are using virus. Something like that. To kill the bacteria, we're using virus. It is going on thing. And for cloning vectors, we use. And the bad thing with bacteriophage, they cause they transfer the drug resistance. No, from one bacteria to another, it is spreading the drug resistance. That's what bacteria gets resistant. Very one of the reason. Apart from this transduction, if you remember, we have this the transformation, transduction, conjugation mechanism. This is one mechanism. Okay. So, and it code for many bacterial toxins. If you remember, diphtheria, cholera, Shiga toxins are phage mediated. We call it as phage mediated. That's an important question, especially diphtheria and cholera frequently asked in the exam. Shiga toxin also, they're frequently causing this. Okay, this much only. Okay, this much. The picture is also given here. You can go to this picture also once again. Okay, yes, right. Now, so everything is clear here. Now, I think we have come to our last topic. Yeah, this is our last topic. Yes. No, I think one more we have. Yeah, opportunistic infections. Yes, so no problem. So cytopathic effect, when you go to cytopathic effect, this is the picture I want to show. Whenever, okay. So viral cytopathic effect means, I'll tell you, I'll brief what is it exactly. Viral cytopathy, whenever you're growing the virus in cell culture, what happened? It produces some effect. It produces some effect on the cells. So that is, that effect on the cell is, that effect on the cell helps in diagnosis of the individual virus. So usually what happens, shortcut to remember, everything in the cell, it becomes roundish like, okay, everything goes round shapes. Okay, round shape. Example, round multinucleated giant round cells. Okay, giant cells. So it will be like the cells will, if you remember, there is this multilayered giant cell can be formed. So that's also round shape only now. And there will be roundening and ballooning. Balloon also round shape. No, ballooning. Okay, ballooning of the cells. Another effect. Okay, so it will be like cells will be like a balloon, big. Round. Okay, it's going to be easy now. You'll understand why I put everything round. Okay, this one. And another one is, other one is vacuolation of the cells. You can see the cells are getting vacuole. The cell inside there will be vacuole. That also round. Okay, one. Another thing, it become like a grapes like clump. They form grape like clumps also. Another possibility, it means they form like this clumps. Grape like clusters, Staphylococcus aureus, different story. So grape like this also round. So see, everything is like round things only. Very simple to remember. And only one thing is different, that is your crenation, degeneration. There's a crenation and degeneration. Here it looks like a leaf. It looks like a leaf-like appearance. Okay, now you have to tell the example of all these things. So shortcut is, when you talk about a multinucleated giant cell, MNGC cell, we call MNGC cell, you always remember which one? Measles, Barthin Finn Kidley cell, if you remember, very important question. And also all the herpes viruses, herpes simplex viruses, even herpes zoster also, mainly herpes simplex viruses. So you will not forget this one. Okay. Ballooning means HSV. Why HSV? In HSV, we have vacuoles. Vesicles. We have the vesicle. The vesicles are like balloon only, no? The infection of the vesicle. So remember like that. Okay, ballooning HSV. Okay, that's also one more question. Vacuolation, the name itself has, we call SV40. Okay, that is stimulating vacuolating vaccine only. Simian vaccine, it's called Simian vacuolating virus. The name itself has SV. So V for vacuole. So no need that will be easily marked. You will not make mistake. Grape like who likes? I always say Adnan Swami. Adnan Swami. He is not only have space vehicle. He is space vehicle virus, but also he likes grapes. So adenovirus. Very, very simple. What about crenation and degeneration? Crenation is like a leaf-like structure. So there is anything looking like a leaf-like things. If you remember, you leaf, nowadays people eat what? Leaves. For everything is Ayurveda and then they like to eat leaves. So entero, no? So enterovirus. Very, very simple. See how easy it is. You would have easily scored 5 out of 5 just writing this. And if you want to, the picture is already given here. You can, I'm sorry. Here on the picture. Yes, you would have seen everything is mentioned here. Also, shortcut, you can see this also. It's from internet only. It's very good picture, I would say, with the exact thing you're going to write. Okay, very, very simple. Okay, now next question. So diffuse ballooning. Ballooning means what you have to think. Balloon is like balloon. Okay, like this. So what happened in some of the herpes? This is the genital emanating genital male penis. You're going to see the what you will see. You'll see something like this. So those are the vesicles. Vesicles in the which one? Of course, herpes simplex virus. So easy. So your answer is herpes simplex virus. Simple. This is one of the clue. So balloon is like a vessel. The balloon is like a vessel. So vesicle means HSV. So remember like that. Make a clue like that so you'll not forget. Okay, finish. Next. Now, yes, I'm going to clear this one. And then we come to the last topic, opportunistic parasitic infection. We have already parasite, we have just nicely we have made juice and we drank. So now we'll see how much we are remembering it here. So opportunistic parasitic. So in HIV infection, there are a lot of infection. There can be bacterial infection, viral infection, and parasite. So here they mention only parasite. So we stick only to parasitic infection. So what are the list? First list, which one you're going to write? The first one you're going to write, the toxoplasmosis. Definitely you're going to write toxoplasma. Toxoplasma you're going to write. Then second one, we'll talk what to discuss. Other one is your acid fast parasite. Acid fast parasite. Especially two are very common. That is your cryptosporidium, and other one is your isospora. Very less cyclospora. Cyclospora is very, very less, not that much common. The crypto and isospora are very, very common, so you have to mention it. Okay, right. Okay, next, what else? Apart from this, very systemic, it can be strongyloides. Another one is your, apart from strongyloides, you're going to have leishmania. Leishmaniasis, and one more is microsporidia. Microsporidia also nowadays is becoming very common. So these are the 5 things you have to mention. Okay, have to mention. And then little bit points. Toxoplasma, what it causes, usually causes which are encephalitis. Ring enhancing lesion. If you remember, ring enhancing lesion, you can write. That's always asked. Ring enhancing lesions can happen. So brain will be affected in toxoplasma in HIV patient. These things usually causes diarrhea. You know the diarrhea. So they're acid fast bacilli. You have to stain Zeal-Nielsen with 1% H2SO4. Okay, diarrhea. Strongyloides causes systemic infection. They can affect anything. They can affect your liver, in blood vein, spleen, any organ. So systemic infections it can cause. Microsporidium, again, it can cause GIT. It can cause again diarrhea. Sometimes systemic also. So these are the 5 characteristic opportunistic parasitic infection. You're going to mention it. This much only. Okay, so very, very simple. So everything is again explained here very clearly. It's written here. You can see everything is mentioned. So these, if you write, it's going to be more than sufficient. Okay. So that's all. We have come to the end of the class. So once again, doctors, thank you so much for watching our Oracle. Don't forget to subscribe and get more information, more benefit. It's going to be amazing. More discussions coming. So within December middle, this 90 days, you are going to be thorough with your subject. Okay. So that's all for today. Thank you. Bye.